So first of all, good afternoon to everyone, and thanks organizers for giving me this opportunity. So I'm here to discuss, basically give an overview of this phase 3 randomized control trial on acupuncture for the chemotherapy-induced peripheral neuropathy and neuropathic pain. So in her trial, basically in her talk, Dr. Ting has given an overview of the acupuncture. First of all, we should know what is acupuncture. Basically, this is the Chinese medicine devices which use very thin stainless steel needles which are inserted and manipulated into the body, into the some points. When this device is associated with some electrical current, this is called the electroacupuncture. There is another word, that is the sham acupuncture, which I will discuss later on. Basically, sham acupuncture is a type of the placebo, with a similar type of needle are inserted into the body, but at different points other than the acupoints. So what are the acupoints? These are the
Slides
very high...
are not moving.
Yeah, I'm on the same slide, ma'am. Acupoints are the high density of the neurovascular structures, which are generally situated between the muscle group or at the edge. These have the low electrical resistance. There are various hypotheses regarding the function of the acupuncture. According to some, it acts through the neurohormonal pathway, which activate the hypothalamus, pituitary gland, and change in the neurohormonal peptides like beta endorphin and enkephalin. According to some, it manipulates the neurotransmitters and activates the brain-derived neurofactors. Neurogate theory, which says that non-painful stimulus block the pain perception. It stimulates endogenous pain-inhibiting pathway and produces the analgesic effect.
Dr. Surabhi,
yeah, ma'am?
Your slides are not moving. You are still on the first slide.
It is showing me. Now it's moving, ma'am?
No.
What is showing here?
Dr. Surabhi, please.
Can technical person can take care of this? It's not moving here.
Dr. Surabhi,
Now it should move. Try scrolling, Dr. Surabhi, please.
It's not moving. Yeah. And now you can see it's moving.
It's moving now.
It's moving now. Okay. So it acts also to the immunomodulation and changes the cytokines concentration, interleukin 2, 6, 8, and 10. It also modulates the brain activity, which can be well depicted to the functional MRI studies. It's moving now?
It's moving.
Yeah. So we know that breast cancer survival has to undergo the aromatase inhibitors, and the most common complication of aromatase inhibitors are the musculoskeletal pain. Sometimes it's so severe that most of the patient has to discontinue the aromatase inhibitors use. So there are various studies which have shown the use of the real acupuncture and compared to sham acupuncture and weightless control. So Crew et al. Has shown that real acupuncture has the good response as compared to sham and other, while other 3 studies have shown that real acupuncture is equivalent to the sham acupuncture, but both of these modality is better than the weightless control. So acupuncture, another study by the Hirschman et al., which was published in JAMA, which has shown that acupuncture has statistically significant reduction in joint pain, which was the aromatase inhibitors used, and it was persistent up to the long-term follow-up. We can see here that 2-point reduction in the pain scoring is much more in the 2 acupuncture arm as compared to sham or weightless control. Another trial, that is the PEACE trial, which was done basically again for the musculoskeletal pain among breast cancer survival, which compared the electroacupuncture with the auricular acupuncture and usual care. So both of these interventions have shown that there is an improved pain-related function interference and improved physical and mental quality of life. And up to week 12, there were reduced analgesic use, and it was continued up to the week 24. It means its response was consistent. Adverse effect is seen both the arm, but it was more in auricular acupuncture arm, but it was mild. But 10% of patients discontinued this treatment due to the discomfort. Another symptoms which has seen in breast cancer survival with the vasomotor symptoms, that patient present with the hot flushes, night sweats, and this is due to the use of the endocrine therapy. Symptomatic management is though challenging. Estrogen therapy we know is the most effective treatment modality in this patient, but it is associated with increased risk of recurrence as well as development of the new breast cancer. So what is the option? Integrative medicine therapy may be the another option for this type of the patient. There are different trials which has been done regarding this management of hot flushes. And these trials basically compare the real acupuncture with other alternatives like sham acupuncture, gabapentin, venlafaxine. And most of these trials have shown that real acupuncture has shown the good result, and shown the symptomatic benefit in the patient when compared to other comparative arm. Another trial, that is acclimate acupuncture trial, which has also shown that combined therapy in the form of individualized acupuncture and self-care regime has shown the much better and the more consistent response up to 6-month follow-up as compared to enhanced self-care group alone. Insomnia is another symptoms which are seen in our breast cancer survival patients. So there was another study that is called the CHOICE, which has compared primary endpoint of this study was 8-point reduction in insomnia severity index. So these trials have also shown that acupuncture as well as the cognitive behavior therapy for the insomnia, both have shown the good and consistent response, but they prefer that CBT is more effective in the white, male, educated patients and patients which are not having the pain. Yeah. Now coming to the CIPN, that is the chemotherapy-induced peripheral neuropathy and the pain. So various modality has been used for this CIPN, acupuncture, and as well as the duloxetine, but there was no head-to-head comparative trial of these modality, but individually both of these modality had changed the regression of the pain score in both the arms, duloxetine having the more side effect in the form of fatigue, insomnia, nausea, but acupuncture is showing the mild bruising only. Another trial was, this was the phase 3 pilot randomized trial, which was done by Bio et al. And they have shown that therapeutic benefit of the real acupuncture for neuropathic pain is consistent with previous pilot acupuncture of CIPN trials when compared to sham and the usual care arm. So keeping in this mind, Dr. Ting Bao has designed this ACT scheme. This is the randomized phase 3 clinical trials, which is for the acupuncture for chemotherapy-induced peripheral neuropathic pain. So this is currently undergoing trial, and its started date was 21st May 2021, and estimated study completion date is 21st May 2025. So they have basically targeted to enroll 250 breast cancer patients who has completed their neurotoxic containing chemotherapy at least 3 months prior to the enrollment in the study, and patient must be having the moderate to the severe neurological neuropathic pain. And these patients should not be having the pacemaker and should not having the electronic medicine devices. So these type of patients are excluded from the study, and also patients should not take in acupuncture therapy for any reason, at least within the 1 year of the enrollment. So randomization is basically will be done in the 2 arm. First arm is the electroacupuncture and the another is the sham acupuncture. In both of these arms, patient will receive 10 sittings of the intervention. Within the first week, they will receive twice weekly. After the up to the 8th week, they will receive the once weekly. So that's committing total 10 sitting in each arm. So assessment will be done, basically difference of the pain severity from the baseline to 8 weeks. After baseline, that is a time frame is the 8 weeks. And primary outcome will be the patient's rating his or her average pain within the past 24 hours. All participants will fill out the brief pain inventory short form. So this is the undergoing trial, so we cannot comment on result. So coming to the summarize the things, healthcare provider should be aware that acupuncture possesses the minimal risk. Though some serious adverse effect has also been seen, like pneumothorax, broken needles, infection, but these incidents is very rare. Minor side effects are usually seen, like mild bruising and the mild bleeding. But we must see that it carries a potential significant benefits, and it may be a reasonable treatment option for breast cancer survival to alleviate treatment-induced side effects like musculoskeletal pain, hot flashes, insomnia, and most probably in chemotherapy-induced peripheral neuropathy and neuropathic pain, though additional studies are needed to comment on this. So my take-home message is that acupuncture is a fascinating option for CIP management, but it will be too early to recommend its use for clinical practice. Thank you.